funny. My backbone hurting me, my knee bone hurting me, my shoulder hurting me. Look how I walking funny.
Well, facts are facts. We have back pain this morning on the Now Morning Show. So thankfully, Dr. Rohit Das joins us once more from the Freeport Medical Center to give us some insight specifically on back pain. Good morning and welcome back.
Thank you very much. Good morning to you and all our viewers on TTT, The Morning Show.
It has really been a beautiful, informative conversation every time that you come through. And this one, back pain and spinal issues, is a common issue. So getting into it right away, why do you think that is? What is wrong with us?
Yes, it's really a very common problem. And I would say, like, on a daily basis, we at Freeport Medical Center would see at least 2 to 3 patients with this problem, and it's so common. When you think of back pain, you think of the part of the vertebral column between the thoracic spine to the just above the sacral bone. And I know we had a picture to put up. I don't know if we can get that.
Those visuals will come up as we talk. Yeah.
In terms of that, the anatomy of the back is pretty simple, where the spinal column contains the spinal cord, which passes through that space to the back there. And then, of course, each vertebrae has its own anatomy, where between each vertebra you have a disc. So you have a disc between each one, you have the spinal cord, and then as the spine continues going down, you'll have nerves coming out on both sides. Right? So any structure in that anatomy could cause back pain. So back pain could come from, let's say, the muscles that hold the spine together. You can have spasms. And yes, look, we have it up on the screen there. So the muscle that hold the spine together, you can have severe spasms from the muscles. You can have what we commonly refer to as a slip disc, if the disc move out of place, or if there's degeneration of the disc. Where the nerves comes out from the foraminers, you can have a pinched nerve. You can also have problems within the joints that hold the bones together, like arthritis. And all of these, sometimes we class it as non-specific back pain because they're all so related. And sometimes we even call it mechanical back pain because of the relationship that they all carry. Other than that, back pain being so common can also come from specific things like a tumor or cancer in the spine or infection. And then, sometimes we sometimes refer to as referred pain. Like if you have a kidney problem, it could also cause back pain. And in females, commonly, you can have problems with the ovaries and adnexal problems. So back pain is really a common thing, and that's why we decided to make sure and bring this up in this
Definitely
segment.
Appreciate it, because what you've described is everything from muscular to actual bones being impacted, and then of course the secondary or seemingly more severe instances where it's something else, and the back pain is probably an indicator of such. It sounds then that we really need to be able to distinguish when it's more serious, perhaps. 2 Panadol mightn't save you if it's your kidneys affecting your back. So how do we diagnose or determine that it is something more serious?
So sometimes I try to think of back pain as acute when it's within the first 6 weeks, and patients come to us, and we go through the steps of investigating and diagnosing them. And then if the pain persists and it goes over 12 weeks, it's considered to be a chronic problem. In terms of severity, patients, when they come to us, we tend to want to diagnose quickly, because if these problems are not treated, it then becomes complicated and then can lead to more serious problems. So let's say in terms of persons who has back pain going on chronically, we consider that to be one of the serious and has to be investigated as soon as they come to us, because patients sometimes would have the pain and try a Panadol, try something at home, not knowing that it could be something serious, right? If the pain is related to either a pinched nerve or a slip disc, they would then complain of sometimes pains radiating down the leg. There may be some numbness, there may be some paresthesia, meaning that there loss of sensation and so on. We consider that to be another serious problem. If it's could be a possibility of cancer. Like if there's a family history, if patient is complaining of weight loss, should be investigated urgently. And if, of course, an infection. Infections can, of course, lead to serious complications.
Right.
Patient will then present with fever and, of course, the back pain and other symptoms. So these symptoms have to be investigated quickly.
So it's reassuring then to know that you have a number of diagnostics available at Freeport Medical Center. There will also be treatments, I imagine, coupled with that as well.
Yes,
so talk me through a little bit of what the diagnostics might look like.
Yes.
And then what treatment options we have.
Yes. Right. So if a person comes to us, a patient comes to us with back pain, first of course we interview them properly, and when we start to investigate, the basic test that the person will get is an X-ray of the back. And this, of course, will check for a number of things. It can help to diagnose spasms, arthritis, etc.
Right.
And then you go forward with CT scanning, which, of course, goes into in-depth three-dimensional imaging of the spine. It can also check the discs, check the nerves. And in this way we can help to diagnose these other problems.
Right.
In terms of infections, we have to do blood tests, which the blood will be able to tell us. Some other general causes like autoimmune diseases can be diagnosed with blood tests as well. And of course, patients with, particularly females and patients may have kidney problems, you have to do ultrasound. So
right.
there are a number of tests that has to be done, and this is how you could properly diagnose and then start treatment.
So let's talk about that treatment.
Yes.
What options do we have there?
In terms of treatment, I always tell patients that you must be diagnosed properly first, right? So you get your diagnosis, you get your test, and then obviously we must start with managing the patient's pain management. Patients come to you, they have been having pain, they may have tried over-the-counter stuff and things like that, tablets, and the pain is not going. Particularly if it's a serious problem like a pinched nerve, a slip disc. There's a particular problem called cauda equina syndrome. That's a syndrome where the nerves from the spine, that before they emanate into the body, they can get entrapped and cause lots of problems, like problem passing urine, problem, going off in the toilet and so on. So we first manage the pain, and there are a number of things that you can use, medication, injections particularly. The root cause of pain, as we always know, is inflammation. You have to manage inflammation, and you can use injectables for this type of problem. And particularly patients who have physical and laborious jobs where sometimes they do a lot of lifting, right. Even sometimes jobs that involves bad posture and people sit for long period. We have to talk about rehabilitation in terms of back pain, especially if you catch them early. Managing their weight, obesity is another risk factor for back pain. Right. You have to ensure that patients get involved in exercise, strengthening exercises, particularly the spine muscles that hold the spine together. So rehabilitation is important, pain management, and treating all the other problems that can arise from the investigations.
Of course. I just wanted to make certain that we reiterate how much is available right there at the clinic, because that would mean that we're able to see the problem, rectify the problem, and even treat the problem for long term. Yes. So we're really grateful for those offerings. Now, in terms of the actual other offerings, because you did mention sometimes the back pain is as a result of some other chronic or severe illness, there are other diagnostics that you have to go through and other treatments that you have available as well. Let's talk a little bit about the health packages, specifically around heart health and a few other options, just because we may not even realize this is what we need.
Yes. Yeah, at Freeport, we proud ourselves of making healthcare affordable and accessible. And we have said in some of the previous sessions where we have introduce different types of packages to ensure that patients could get properly checked and treated. In terms of the health package, we are proud of having one of the we are one of the pioneers in CT scan and cardiac and angiograms, where we can diagnose blocked arteries. We are actually the first in Central who have been able to diagnose blocked arteries with coronary angiograms. And we also have different packages for men health, cancer packages, diagnosing cancer, breast cancer, prostate cancer, all different types of cancers. We also do the packages for coronary angiograms and cerebral angiograms as well, persons who are at risk of having strokes, etc.
Fantastic. So once we know what we are likely to be susceptible to, we can start taking these specific plans to manage the health of, well, ourselves. Yes. Beautiful to hear and very accessible as it is in Central. But this is another informative session. Unfortunately, it is the final one for us here on CCT. So as we wrap up, what final message would you like to leave with our viewers?
Really, I am really a proud representative of Freeport Medical Center. We have come to the last session for this year. I think that, we have tried to bring forth what we offer in Central and to enlighten our patients, how best we can help and be there for them. And we also tend to function by our motto by taking patient care to the next level, which is taking patients from a state of not well to a state of wellness. And we are proud about that, and I would like to ensure our patients that when they come to us, we take them straight through to the point of being well. And I would like to also emphasize the importance of accessibility and affordability, which we are very proud of.
Definitely, with every single session. And of course, making sure that you not only make sure that it's accessible and affordable, but you've also educated us quite a bit. We really appreciate the insight you've shared with us each morning. And if persons wanted to connect with the clinic, please remind us of contacts, even though they've been up a few times while you were speaking.
We are available at 673-1069 and 681-8174.
Nice.
Also available on social media, Facebook, etc. So we have also extended our open hours until 8 p.m. daily to ensure that persons who are, not able to come during normal working hours can take advantage of the evening hours as well too.
Dr. Das, thank you so much for continuing to do the great job that you do, for sharing the information with us, and for being an exemplary example of medical here in Trinidad and Tobago, but specifically at the Freeport Medical Center. You guys can check them out in Central, North, South, East, West. You could head there and get your diagnostics, your support, your education, and wellness all together. Thank you again for joining us this morning.
Thank you very much for having me.
Of course, Dr. Das is the Medical Director and CEO of the Freeport Medical Center, and you can find them online for more information. But for now, we'll take a break and come back with more after these messages.
My backbone hot in me, my knee bone hot in me, my shoulder hot in me. Look how I walk in funny. My backbone hot in me, my knee bone hot in me, my shoulder hot in me. Look how I walk in funny.